everybody and welcome back to my channel, Contour and Cancer. If you watched my last video, which was about CT scans, you'll notice that I look exactly the same. That's because I recorded it about 5 minutes ago. So I'm being very good and trying to record in advance. This week I wanted to talk to you about what I take with me when I go to chemotherapy. And everything that I take with me goes in this humongous bag. I take, because you never know how long it's going to last. I mean, my actual chemo is 55 millilitres over 5 minutes. But by the time they've got the IV in and the pharmacy's sent the prescription up and blah blah, it can, sometimes I've been there up to 4.5 hours. So I never take for granted that I'm only going to be an hour. I always plan for a few. So what do I take? First off, I take water. Not that they don't give me water, they always provide me with a jug of water when I get there, but I like to drink a bottle of water on my way up to the hospital because that helps to plump up my veins as much as possible. And I try to drink another one on the way home because I'm trying to flush the chemo out of my system. So I always have water. Another thing that I always take with me is some food because, I'm sorry, but hospital food is vile. Especially the cardboard sandwiches that you get for lunch in the chemo unit. I don't know why, but they seem to think that buttering one piece of bread and putting cheese on the other side is a sandwich. No, it's not. So we always take food for me and Pete. I also take a bag of boiled sweets because the chemo sometimes can taste really bad. And your mouth can really dry up, so I always have boiled sweets. What else do I have in this bag of tricks? I always have my tablets, lunchtime or tea time, according to what time my appointment is. Sometimes I'll take both, especially if it's sort of, my appointment is close to my dinner time tablets, lunchtime tablets. And I could still be there for tea time 4 hours later, so I always take my tablets with me. What else is in here? Hand gel, obviously, antibacterial hand gel, and a pen. That's in there. I also take with me a Sudoku book. My main sort of pastime in the hospital is my tablet, a Samsung tablet, not the ones you swallow obviously, but sometimes, you know, sometimes the battery can die or you just get really bored, so I always have a Sudoku in my bag. My tablet, obviously, Pete's tablet, Pete's glasses, and then this envelope goes everywhere. It goes to the hospital, it's in my handbag at all times. Basically, because it's got my neutropenic card in it, so, but this carries everything. So what's in here? So in here we have, let's go through it as it is. Right, so this is from last week when I had my CT scan. Basically it said that the procedure I had was a CT. It was ordered by the doctor, and it also gives me some aftercare instructions, such as drink at least 2 litres of fluid over the next 24 hours, return to a normal diet, and things like that, and contact numbers in case there's any problems. So that's in there from last week. The next thing in there is the patient agreement forms. You have one of these for every procedure. So these are my chemotherapy ones. So this one is for eribulin. It basically states the name of the treatment, who's ordered the treatment, and their statement, which is to tell you the benefits of the treatment, so why you're having it basically. In my case, this eribulin is intended to shrink the cancer in the body. It also gives you the side effects and risks, the common ones such as nausea, vomiting, tiredness, hair loss, neuropathy and sepsis, risk of liver and kidney damage, risk of bleed and blood clots. I really do not know what on earth the rest of that says. But anyway, it gives you the side effects. It also gives you the date that you should start the treatment, how many treatments they plan to give you, and then you sign it and it's signed by a witness. So that's the eribulin one. There's the one for the capecitabine, the tablets that I was on before, and that's the paclitaxel that started last year in September. So they're in there as well. It doesn't happen often, but I have been asked in the past for if someone can see the paperwork where I've agreed to the treatment, so they're in there. This is what I meant by the neutropenic card. Neutropenic sepsis, it just basically it just says that you're on treatment, and it's for if you have any accidents or ambulance or whatever. It tells them that there is a chance that you could be neutropenic because you're on chemotherapy. So I'm supposed to carry that everywhere, which I do. It's in the pink folder. Everything's in the pink folder. What's this? This is the info sheet on eribulin that I'm given before I start the treatment to read through. What is eribulin? How it's given, the side effects, less common side effects, other information, blood clot risk, and things like that. So that's in there, just so that I can have a look. If I'm having some sort of a side effect, I'm not sure if it's connected to the chemo or if I'm just unwell, I can have a look at this and say, oh yeah, that's a side effect, it's fine. So there's that. I have the contact for my secondary breast cancer specialist nurse. I have my blood card for next time that I go to see the, oh no, I've got to have it done tomorrow actually, before I go for my day 8 treatment. So that's my blood card. I also have, I carry all my recent appointments with me. So this was the appointment for the scan for last week. So there's that. There is my appointment card that I'm given at the hospital. So I've got 18th of the 9th treatment, and then on the 1st of October I have my next review. So that's there. This is a photocopy. I have all my tablets given to me by the chemist in Medipacks. So what I do is I photocopy the Medipacks and add in anything else that I need to that's not given through the Medipack, such as the deltaparin, that's not on here, and things like that. So I write them down and they're in there, and then if I'm ever sort of taken into hospital or whatever, there is a record of all my medication. So that's that. And then the last thing that's in there is this chemotherapy assessment card. Oops, sorry, if you can see that. So what this is, basically, it's double-sided, and it gives you sort of red, amber and green on how you're feeling, basically. So green is normal temperature and feeling well. Red is a low temperature below 35 degrees or a high temperature above 38 degrees. And what it says here is red boxes, you must ring the emergency assessment unit immediately. Amber boxes, 2 amber symptoms, you have to ring for advice. And green boxes, you're fine. So it's things like diarrhea. If you've only had 1 episode in the last 24 hours, that's green, that's fine, don't worry about it. 2 to 6 episodes in the last 24 hours is amber, so keep an eye on that. If you have 7 or more episodes in a day, or incontinence with or without abdominal pain, or bloody diarrhea, then that's red. Straight away you've got to ring the assessment unit. What's another one? Sore mouth. Painless ulcers, redness, mild soreness, but able to eat and drink, that's green. It's fine. Painful redness, swelling or ulcers but can still eat, that's amber. So if you had that and you'd had 2 to 6 episodes of diarrhea, which is another amber, then you would have to ring up. And the red on the sore mouth is painful redness, swelling, difficulty with eating and drinking. In that case, you would have to ring straight away. So that's sort of just a general, what to do and when. So that's what's in my pink folder. And basically, that's what's in my chemo bag. If I'm wearing my wig when I go to chemo, I'll make sure there's a hat in there in case my wig gets too warm and I want to take it off. If I'm wearing my contact lenses, then I will take my glasses and my contact lens bottle so that if my eyes get dry or sore, I can change them. But other than that, that's about it. That's my chemo bag. So I hope you enjoyed this video. It's been quite a short one, I think, this one. Yep. If you did like it, press the like button. Consider subscribing if you don't already. Press the bell so that you get notified of my next video whenever that comes out. And any comments that feel free to leave in the box below. I will answer you. I will answer every comment. So that's that. So thank you for listening. Thank you for being here. See you soon. Bye.